A recent randomized controlled trial has cast a hopeful light on a simple, low-cost intervention that could make a meaningful difference for older adults concerned about cognitive health: magnesium supplementation. The study, which enrolled hundreds of seniors over a 6-month period, tested the effects of a modest daily dose of magnesium, roughly $5 per month in retail cost, on memory performance, sleep quality, and markers of cognitive aging. While the findings are still preliminary, they offer a tantalizing glimpse into how a widely available mineral might contribute to brain health, enhance quality of life, and potentially slow age-related cognitive decline. The participants in the trial were aged 65 to 80 and generally healthy, though some had mild complaints of memory lapses or disrupted sleep. They were randomly assigned to receive either the magnesium supplement or a placebo, and both groups underwent detailed neurocognitive testing at baseline, 3 months, and 6 months. The assessments included memory recall, attention tasks, executive function measures, and self-reported sleep quality. Researchers also monitored basic blood markers, including magnesium levels, to confirm absorption and safety. What sets this study apart is its rigorous design and the inclusion of multiple, practical outcomes: memory performance that affects daily function, sleep quality that impacts mood and alertness, and nutrient status that is easily measurable and modifiable. By the end of the trial, participants taking magnesium demonstrated modest, but statistically significant improvements in memory recall and spatial working memory compared with the placebo group. For example, in one set of verbal memory tasks, supplemented participants remembered an average of 3 more items per list than they had at baseline, while the placebo group showed little change. Executive function tests, including planning and problem-solving exercises, also trended upward, suggesting that magnesium may help maintain not just recall but higher-order cognitive processing. Importantly, these cognitive gains were accompanied by better sleep metrics. Supplemented participants reported falling asleep more quickly and experiencing fewer nighttime awakenings, findings consistent with prior research linking magnesium to regulation of the sleep-promoting neurotransmitter GABA and modulation of circadian rhythm stability. Beyond individual outcomes, the study underscores the broader public health appeal of a low-cost, widely accessible intervention. Magnesium is readily available over the counter, inexpensive, and generally well-tolerated, making it a potentially scalable strategy for communities seeking to preserve cognitive function in aging populations. Unlike pharmaceuticals, which often carry side effects, complex dosing, and high costs, magnesium offers a minimally invasive, practical approach that aligns with preventive health philosophies. Public health practitioners, geriatric specialists, and caregivers could incorporate magnesium supplementation into broader strategies for cognitive maintenance, alongside diet, exercise, and mental stimulation. Safety and tolerability were emphasized in the trial, and the results were reassuring. No serious adverse events were reported, and mild gastrointestinal complaints, such as transient loose stools, were rare and resolved without intervention. Blood magnesium levels remained within normal physiological ranges, suggesting that the doses used were both effective and safe. The simplicity of the regimen, a single daily tablet, also supports adherence, a key factor for long-term benefit in older adults who often manage multiple medications or supplements. The study also sparks interesting questions about mechanism. Magnesium plays a critical role in numerous neuronal processes, including NMDA receptor modulation, synaptic plasticity, and neuroprotection. Animal studies suggest that magnesium deficiency can accelerate age-related neuronal loss, while supplementation may strengthen synaptic connections and enhance long-term potentiation, a biological process underlying learning and memory. While this trial cannot definitively prove causal molecular mechanisms in humans, the convergence of cognitive improvements with sleep benefits hints at a holistic neurological effect, where improved sleep may itself reinforce memory consolidation and executive function. Equally important is the psychological impact of an accessible intervention. Older adults often feel powerless in the face of cognitive decline, and the promise of a simple, affordable supplement that may improve memory and sleep is empowering. Even modest improvements can have meaningful effects on daily life, remembering appointments, cooking safely, or maintaining social interactions. These functional gains translate into higher independence and quality of life, outcomes that are as valuable as objective cognitive test scores. While enthusiasm is warranted, researchers caution that magnesium is not a cure-all. Its benefits are likely incremental, and the trial participants were generally healthy older adults. Individuals with significant neurological disease, advanced dementia, or severe comorbidities were excluded. Nevertheless, the results suggest that magnesium could serve as a foundational strategy in a comprehensive approach to cognitive wellness, one that also emphasizes diet rich in leafy greens, nuts, and whole grains, regular physical activity, mental stimulation, and social engagement. In the long term, this research may influence public health recommendations and geriatric practice. If subsequent larger trials confirm these findings, magnesium supplementation could become a standard, low-risk, and cost-effective tool for maintaining brain health in older adults. Importantly, the intervention exemplifies a broader principle in preventive medicine: small, practical, and scientifically grounded measures, accessible to the majority, can produce measurable improvements in cognitive function, sleep quality, and overall well-being. In summary, this trial paints a compelling picture of how a $5 monthly supplement might help older adults preserve memory, enhance sleep, and sustain independence. Magnesium's safety profile, low cost, and ease of use make it a rare combination of efficacy, accessibility, and simplicity in the realm of cognitive health interventions. While more research is needed to refine dosing, duration, and target populations, the study offers a tangible, positive step forward: a practical, affordable, and scientifically supported means for seniors to engage proactively in maintaining their brain function and quality of life.